Hello, everyone. Welcome to our discussion today. As a part of the Medtronics initiative to increase awareness about Parkinson's, today we're going to talk about how keeping a positive mindset and how affirmations can help those who are going through the Parkinson's disease. I'm Simran and I'm joined by Dr. Guruprasad today, who has extensive experience in this space, and he shall help us know more about Parkinson's and its management. I would request Doctor to introduce himself.
Hi everyone, I am Dr. Guruprasad Hosurkar. I'm a senior neurologist at Manipal Hospital, Yeshwanthpur. My interest is at Parkinson disease and movement disorders.
Thank you so much, Doctor, for taking out the time to join us today. Can you tell our viewers a little bit on what Parkinson's is?
Yes, so Parkinson disease is the second commonest neurodegenerative disorder, what we know. The first being the Alzheimer's dementia. So when we say neurodegenerative disorder, that means that with age, everyone will have some degeneration. Some people may have, knee pain. Some people have low back pain. So there is degeneration of our tissues. But same thing can happen in brain, and that is sometimes influenced by our genes. So there is some genetic predisposition. Not everyone who ages will have disorders like this, but genes do play a role. And as we age, some of these people develop slowness in their walking, stiffness in their movements. That gets reflected in terms of slowness of their body movements. Their day-to-day activities become slow. Some people do have tremors. And the focus of neurodegeneration in Parkinson disease happens in area called substantia nigra, where the neurons specifically, which have neurotransmitter as dopamine, gets degenerated. So the motor circuitry, what is very important for us, for our movements, gets degenerated. So the hallmark of Parkinson disease is slowness of movements. And then the other things add up, like tremors, be it stiffness in the body. And usually one side of the brain gets involved first, and then the other side also gets involved. That means the symptoms usually starts in one side of the body, and then over the years, the other side of the body gets involved. The axial, thing features, the trunk, our neck, speech also gets involved.
Thank you, Doctor. That was really informative. Just to follow up on that, because you mentioned it was also genetic. Do people usually get it before their old age, or does it only occur in people once they're like 460?
Right. So age, as I said, is a very important risk factor for Parkinson disease. So it's usually seen above the age of 60 years. The prevalence of Parkinson disease in the population, increases significantly as every decade after 60s. But having said that, it doesn't mean that it doesn't happen in young people. It still can happen below the age of 60 years. We see a lot of patients at the age of 40, 50s. The typical Parkinson disease. That means whatever symptoms I mentioned, slowness, stiffness, and tremors. The syndrome of Parkinson disease can happen in a younger age group as well, and they behave typically as someone who starts above the age of 60 years. But there is also an entity called young onset Parkinson disease, which can happen below the age of 40 years, and then something called juvenile Parkinson's, which happens in 20s. There, the genetic reasoning is very much established. That means clear-cut genetic mutations have been identified. In India now, we have access to genetic testing, which we use now, and clearly pinpoint this is the gene which has been mutated, which is abnormal as compared to a normal person, and that explains the Parkinsonism. And the Parkinsonism is one part of the thing. So they will have a whole lot of other neurological conditions along with that, other movement disorders and all. So that is a different category where clearly genes have been established. Whereas the common type of Parkinson's, what we see in our practice, age is the thing. And speaking about the genetic predisposition, there are certain genes which have been identified as genetic predisposition, but there are also environmental factors. Like, for example, someone who's more exposed to fertilizers, staying in rural part of the country, and exposed to a lot of fertilizers, they can have environmental influence on someone developing Parkinson's. We can't pinpoint. For example, I see a Parkinson's disease today, and I can't say this is the reason. So if you ask me, we don't exactly know the particular cause in that individual. But these are the epidemiological studies have shown. And certain protective features also been shown in studies, like someone who's used a lot of coffee or, tobacco. They have been found to be protective against development of Parkinson's disease. But these are long-term studies, so we can't advise accordingly. So if you ask me the common type of Parkinson's disease, we still don't know the complete link. We know this is possible, but we don't know the exact clear link.
Understood.
Yeah.
So it clearly seems that Parkinson seems to be impacting the quality of life severely of those who suffer from it. So how serious can it get, even in the old age, and then even how you mentioned there's juvenile Parkinson's. So how serious does it get in both those cases?
Yes. As mentioned, neurodegenerative disorders are all progressive. Despite best of the treatment available, it's still progressive. That means the symptoms accumulate over the years. Someone can, continue to, have good control for 10 years, 15 years, but eventually they become, disabled in one way or the other. So the disability is in both ways. In terms of, Parkinson's disease, we know it's more of motor disorder. That means there is slowness of movements, there is slowness of speech, there is imbalance, there can be falls, there can be tremors. But having said that, there are also a lot of non-motor symptoms. That means these patients also have constipation, they have issues with sleep, depression, cognitive issues at the late stage. So there can be both non-motor and motor. So the disability mainly what is visible is motor. So some after 10 years or 15 years of the disease, some people will require help in terms of getting up, walking and all as thing. But little early stage, 5 years or 10 years, because of the tremors, they will not be able to write, they'll not be able to type. So their productivity, someone who's working in the office have difficulty in sitting through the meetings. They will have difficulty in concentrating, because the medicine can work for a few hours and then they develop tremors, they become stiffness and all. So continuing with their work also becomes difficult. So it's question of employability, it's question of productivity, and later even day-to-day activities like driving, be it bathing or dressing also becomes difficult. So I had this gentleman walked in today. So he was asking his grandson to help him for dressing and all. So, small things where they can take care of themselves also becomes some amount of, impediment. So that's how, Parkinson's disease thing. So, it's both in terms of their professional work and also domestic, work also gets, impacted because of the Parkinson's disease.
That sounds honestly very debilitating. So how would you recommend that someone even stay positive in this situation? And does keeping a positive mindset and like doing affirmations daily, will these impact such patients?
Yes. So we always, whenever we meet these patients in our clinic, we always tell them to, both the caregivers and the patients to have a lot of positivity in whatever they do, because ultimately hope is very important, and we always stress on that. But that comes with a lot of responsibility, because even though it's a neurodegenerative condition, it's a progressive condition, it's very much treatable. The medications are the mainstay of treatment for Parkinson's disease. Along with later part of the disease, we have surgical procedures like deep brain stimulation surgeries and all. But treatment is very, very effective in Parkinson's disease, unlike probably in other neurodegenerative conditions or other degenerative conditions. So the symptoms can be mitigated to a large extent in Parkinson's disease. So apart from being positive, if they are responsible in terms of taking medications regularly, initially the amount of medication will be less, but later as we go along, they may require frequent doses of medications. So if they take the medications, whatever has been prescribed by the specialist, so a lot of symptoms can be, reduced, and they can have a good quality of life. Regular follow-up. For example, if I, ask for a patient to come after 3 months, the patient the families have to be, responsible to come and see the doctor regularly, because we need to judge the progression of the disease. Once we see that disease is progressed to a certain extent and medications are not working, we can look at advanced therapies like deep brain stimulation surgeries. If the person requires 5 doses of medications, and he has to remember, every 3 hours he has to take the medication. So it becomes a very, a burden for a person. Someone is busy in their work, whether it is a teacher or, a scientist or a doctor. So it's difficult to remember ourselves to take medicines every 3 hours, because if they're working and suddenly, they can't get up, they need some help, medicine effect goes off. And then if you take a medication also, it takes half an hour to 45 minutes to get the effect. So that period of, almost an hour goes very difficult. That's called off period, where medicine doesn't have any effect. So we need to bridge that. So in certain situation like this, we, or some symptoms are not resistant to medication therapy. Like tremors, sometimes, you increase the medications, the tremors in the one side or the second, and both sides of the body don't respond to medications. So in that situation, we offer surgical treatments. So apart from this, things, important is the support of the family and keeping a positive mindset. That means I can get better. I can contribute towards my day-to-day activities. I can contribute domestically to my family. I can continue to work. I can continue to be independent. So all that hope and positivity do help. We also sometimes engage sometimes our neuropsychologists to talk to them and then improve their moral. And then whatever their interests are, like being traveling and all, we encourage them to continue their hobbies, interests, because socializing, continuing to their apart from their professional work also helps them going and then taking care of them.
It's honestly a relief to know that there are so many solutions that are actually out there to deal with the challenges of the disease. But something I'm really curious about, you mentioned earlier that there's a bridge between the medicines, and I think you mentioned it was deep brain stimulation.
Yes.
So can you tell us a little bit more about that and how that can help with the positive mindset as well?
Yeah. So, the medical treatment in Parkinson's disease has been there for the last 50 years, more than 50 years now. In early 70s, levodopa, which is the synthetic form of dopamine, which is deficient in brains of Parkinson's disease, was discovered, and since then it's been the gold standard for treatment of Parkinson's disease, the medication. But over the years, we realized that in few years, after use of levodopa or other drugs in Parkinson's disease, the effect goes off. That means what is called end of dose effect or on-off phenomenon, where if in a person who takes a medication, it will be effective, the symptoms will improve for 7 or 8 hours in the initial period of the disease, and later there will be fluctuation. That means the disease, the effect goes off within few hours. Then they need to take frequent doses. Or someone who's taking a tablet, they get side effects that, like, they get involuntary movements. They can't sit steadily. They keep moving their hands and legs. The head and neck gets movements. These are called dyskinetic movements. Some patients do develop psychiatric complications like hallucinations, because if they're on a lot of medications. Yeah. So the time will come when we need to reduce the medication. If I reduce the medication as expected, the disease symptoms go up. That means they become stiff, they become very slow. So it becomes a real challenge. That's the time when we think about advanced therapies. So the one which has been proven beyond doubt that it helps in these situations is deep brain stimulation. It's been there in India for last in the world around maybe little more than 25 years or little more than 20 years, but in India it's been there for last 20 years. What we do in deep brain stimulation is we put in a lead. We introduce the lead inside the brain, in the deep structures of the brain called subthalamic nucleus, and certain times in a different nucleus called GPI. But usually the STN is the target for Parkinson's disease. We put the lead under what is called stereotaxic guidance, because it's a very small nucleus. So we need to place the lead accurately inside the nucleus, which is part of the motor circuit, which governs our body movements and all. And using the battery, which is kept in the below the collarbone, again under the skin, with the direct stimulation, continuous stimulation of the lead, stimulating the structure, we control the symptoms. The tremors almost stop. The slowness improves, the stiffness improves. So what we expect after deep brain stimulation surgery is that because of the continuous stimulation, of the brain structure where you're targeting, most of the symptoms of Parkinson's disease reduces. That means the medicine requirement post-surgery improves by an average of 50%. These fluctuations, what I said, on-off all reduces. The medicine-related side effects come down, be it psychiatric or motor complications reduces. There is significant improvement of quality of life in these patients. So the younger the better. Usually we prefer our patients to be below 70 years because one thing is the surgical risk is very less. Even though this is safe surgery, but if they are below 70, they are the more preferred ones to go through this surgery. And as we understand, even the disease progresses beyond that, but we have ways to control. If there is a progression, also we can control various parameters in deep brain stimulation and make the symptoms as low as possible, and they can lead. So we have instances where after deep brain stimulation, they've gone back to the work comfortably. We had a teacher, from nearby Bangalore, where she was a high school teacher, and she had difficulty in carrying on her classes because her voice goes down and she can't reach the board and write on the board because of the tremors. Yes, because of slowness and all. So after the deep brain stimulation, she's perfectly, I think. We had one, working person in an IT firm, in a managerial post. He couldn't sit through the meetings, despite a lot of correction in medications. He couldn't do anything, so he had to quit his job. But he made up his mind to go through the surgery, and he is now almost 8 years into the disease. 8 years post surgery, he's doing exceptionally well, and his medications have come down by 80%. And he went on a road trip, multiple times, where he couldn't do anything. He stopped driving, which was his passion. But post surgery, he went on a road trip. He went to Bhutan once. He went to Sikkim once with his family. So that's the type of outcomes we can expect. In patients with the Parkinson's disease post deep brain stimulation surgery. But having said that, we very careful in selecting the individuals because there are certain features which tell us that this person may not be a good candidate for Parkinson's disease. So selection of patients for this advanced treatments also very important. And then post-surgery care is also very important. We need to see them regularly. We need to program the parameters, and medicine adjustment also goes on simultaneously. Yeah.
So it seems a lot like after DBS, the patient can almost be independent and more so keep that positive mindset. But also just to understand, when you said that you only recommend this solution to certain people, is it the people who have that kind of support and that positive mindset and that positive environment all around?
Yes, very good question. Because if you look at that, why very small percentage of patients with Parkinson's disease undergo these therapies. Now, apart from the various other issues, important is selection criteria is very rigid because someone who is a little bit above 70 and has cognitive issues or depression, emotional issues, we have to be very sure about the outcomes. And another thing is family support is very important, even though the day-to-day thing is not required. So this is a very compact device where the implant is all within the body. We don't need to interfere with that every day. So like medications, they need to come, patients who are on medications come follow up every 3 months, usually 3 months, 6 months. Same thing happens post DBS. So that way we don't need them to see regularly. But having said that, we look at all these things where they're comfortable with this. If they need troubleshooting, they can reach out to us. So all that is important. So we have certain guidelines, certain indications, certain things, specifications we look at initially when we think. So age is important, no doubt. And also they have to respond to medications. We do what is called lever upper challenge. Once they have fulfilled this criteria, then we think, and then we do some imaging. We make sure that the scan is okay. There's no other secondary reasons for Parkinson's disease. All that is taken care, and then we subject them to this therapist.
Understood. This has honestly been super insightful on how to maintain a positive mindset and how important that is. And honestly, I think it seems a lot that self-care is super important for the patient and the caregivers. So what are your recommendations around this?
So for every patient of Parkinson disease, apart from medications, regular follow-ups, exercise is very important. So regular physical activity, at least half an hour to 45 minutes of walking. If they can cycle, see, the things change over the time with Parkinson disease. Someone at the end of 10 years of Parkinson disease may not be able to cycle independently. So we choose and recommend certain exercise where they're comfortable with, they're safe. So as simple as regular walking, brisk walking with good amount of arm swing will help them to be thing. Or if they can't cycle outdoors, static cycle can help them to improve their gait. So because one of the important things happen in Parkinson disease, that the walking becomes slow. They shuffle, they develop slowness in walking, the steps become short, the arm swing reduces. So physical activity, in terms of cycling or stretching exercises, swimming sometimes we can recommend if they're a little young. So all this, physical activity, or if they're interested in playing some games like badminton or any other games, competitive sports, they can do it. Or nowadays they are also getting into dancing, acrobatics. So all that, aerobic exercises, all that, I think whatever they've been doing, we need to encourage with some amount of supervision. So exercises definitely play a role in terms of keeping them fit. It helps them Parkinson's disease because the stiffness reduces. The pain associated with stiffness comes down with exercises. And overall, response to medications improves with exercises. And as we all know in our, lives, if exercise that, gives us so much of positivity, our day goes very well, our stress levels comes down. Same happens with Parkinson's disease. And a lot of people do take that, positively and, implement that. And then caregivers, the family members also, I think, and we also recommend a lot of, yoga or breathing exercises. Because even the chest muscles also become stiff in Parkinson's disease. Their breathing also becomes a little compromised. So doing breathing exercises, pranayama also helps them, keeping them fit, and then their overall, feeling fit will improve. Sleep is very important. This gets a little bit affected initially, later also with medications also sleep gets affected. So having good 6 to 7 hours of sleep is very important. That also keeps them alert, active in the daytime, and along with the physical activity. I think in terms of diet, not much in terms of specific in Parkinson's disease, but as I mentioned earlier, non-motor symptom constipation is very much common in Parkinson's disease. So a lot of fluids, regular hydration, and along with high fiber diet helps them to keep their bowel movements regular. And sometimes we use medications to improve their bowel movements. So these are the, apart from advices we give regularly to our patients with Parkinson's disease.
Thank you so much, Doctor, for sharing your expertise with us today. These are really important points to note, and I hope our viewers can also benefit from this. Do you have any final thoughts or words of encouragement for those who are dealing with the disease?
Yeah, so as we discussed, need to keep the positive mindset going because Parkinson's disease is very much treatable. All kinds of treatments are available in our country now. The access to treatment, be it medications, deep brain stimulation, surgeries, is available freely in our country. Many centers are doing it with great outcomes comparable to any center in the world. So we need to take the advantage. The patient's family or any layman needs to watch out for the symptoms of tremors, slowness in their family members or friends. They do need to report to the doctor. And then, once the diagnosis is made, we need to, take the medications regularly and maintain the follow-ups. All this helps to, keep the disease under control and, improve the quality of life in these patients. Thank you.
Understood. Thank you so much, Doctor. It's been a pleasure having you here today. And thank you to our audience as well for tuning in. We hope you found this discussion super helpful as much as I did. Remember to stay positive and take care of yourself. For any more information on Parkinson's disease, please stay tuned to our page.
Thank you, Simran. Thank you.
Thank you, Doctor.